You know when it loads.
Awesome.
I will also be letting our attendees in.
Yeah.
Thanks,
Yes.
Christine.
You're the bomb.
It should go in like 5 seconds.
Okay.
And we are live.
Good evening, everybody. Welcome to Koviki Talk. Koviki Talk is a 21 episode series that speaks about all things COVID-19 from the Pacific Islander perspective. So if we have doctors on, if we have researchers on, if we have data specialists on, they are going to be Pacific Islanders, and they're going to talk about it from our perspective. So there's a lot of information out there about COVID-19. There's not a lot of shows out there that are going to speak about it specifically from the Pacific. I am having a hard time talking today, from the Pacific Islander perspective. So we're 9.5 months, I'm not sure, we're a long ways into the pandemic. We are not putting the brakes on it at this point. We are entering a winter now where we're wondering, the thought is, are we going to be experiencing another rise in cases? With one of the days last week topping 90,000 new cases and reaching a seven-day high, the highest 7-day total that we've had so far in the pandemic. It's not going away anytime soon. So gathering data and getting research done is more important than ever, because it's not like right around the corner, and it's not something that's in our sights that's going to happen next week or the week after. So what we're going to focus on today is being a good research partner. And we have two amazing people to lead us. And I'm going to introduce our first panelist today, Dr. Andrew Subica. He's a health disparities researcher and assistant professor of social medicine, population and public health at the University of California, Riverside School of Medicine. His current research addresses the intersection of health and mental health disparities among vulnerable populations, including persons of color, individuals with psychiatric disabilities, survivors of trauma, individuals experiencing homelessness, and refugees. He is particularly concerned with improving evidence-based treatments, services, and public policies for underserved individuals using community-based participatory action research, deliberative and mixed methodologies. Other areas of study include multiracial identity, acculturation and well-being, clinical assessment, and spirituality for culturally responsive stress coping and wellness. Dr. Subica came to University of California, Riverside after working as a senior research associate at the Loyola Marymount University Psychology Applied Research Center, where he collaborated with community-based organizations to develop and evaluate local and national community organizing and health services projects addressing health, education, environmental, and criminal justice issues affecting low-income communities of color. Prior to that, he trained as a National Institute of Health funded mental health scholar in serious mental illness at the University of Southern California's Clinical and Translational Science Institute, and a postdoctoral clinical fellow in psychosocial rehabilitation at the Doris Miller Department of Veterans Affairs Medical Center. Welcome, Dr. Subica.
Thank you. You do your research, by the way, because I sent you like the one sentence.
Oh,
you found that one. Okay, nice.
We were just talking about one of our previous guests, Dr. Samo, and how long his introduction was and his bio was. And when you said you had a short one, I was thinking in the pre-show, I don't have the short one. I've got the right one. So welcome, Dr.
Okay. Well done. All right. Mahalo.
I'm your host, Carl. I should introduce myself first. And Nackie, please introduce yourself and our next panelist.
Hi, I'm Nackie, and our next wonderful panelist is Dr. Melissa Leyland. As a native Marshall Islander, born and raised in the Marshall Islands, at age 16, she graduated top of her high school in the islands. A year later, she enlisted in the United States Armed Forces. While in the Army, she was offered the opportunity to serve as a logistics specialist within various units throughout the United States and abroad, including Asia and Europe. It was then that she acquainted with people from different cultures and became more appreciative of the diversity she experienced. After 10 years in the service, she moved to Arkansas to attend University of Arkansas in 2004, where she is now a senior part-time status studying international relations. Because of her prior service with the armed forces, she was able to attain her citizenship. And in 2011, she became a US citizen. She now holds dual citizenship. In 2011, along with other Marshallese leaders, Laelan founded the Arkansas Coalition of Marshallese, ACOM. And in the year of 2015, ACOM received its nonprofit status, making it the first organization founded and directed by Native Marshall Islanders. As the executive director of ACOM, she has become a resource contact in both Marshallese and non-Marshallese communities. As the Marshallese community continues to grow in Arkansas, she is frequently visited by many. Welcome, Dr. Laelan.
I love it, Nackie, that you said I'm a doctor, but I'm not a doctor yet.
I promoted you. We do this at every show. Like Dr. Nia promotes people to being a president. I have promoted you to be a doctor. There you go. So today you're a doctor. Thank you. Sorry about that.
Nackie's in our job. Nackie and my job is to we bring down the average IQ of the show from the really smart people so that we can communicate to our audience. We have a tough time just with the bios. We're just struggling to get through the bios.
Welcome, Melissa. Thank you both of you for joining us today at Koviki Talk. So we are focusing on just how to. What are we focusing on?
How to be a good research partner.
Yes, there you go.
And, really from the standpoint of it doesn't seem like no matter how much we say we're right around the corner, we're almost to the finish line. And then cases are, the data doesn't show that. So it's more important now than ever to continue to get good research so that we don't become super spreaders. We don't loosen, have the COVID fatigue and think that, it's all bias and it's passed simply because we're tired or because we're getting misinformation. So being a good research partner is something that's for all of us. It's not just for, those of you that are doing research and doing work with it. It's like, how does the community be a good research partner? So that's really what we're looking at. I'm interested in both, but because of the Marshallese, the situation that we had there and the data that was coming out of there, where there were people in the Pacific Islander community that were saying, is that a typo? Like, are they sure those numbers are right? So, Melissa, from your perspective and the experience that you've had, one, maybe talk a little bit about what's going on with the Marshallese community there. And two, how can the Pacific Islander community be good research partners?
So the landscape here that we have and what we're experiencing on the ground, especially I would say maybe sometime in June, July, things were very bad.
Yeah.
To where we were having a funeral almost every week. It felt like we were losing someone every day. Even a few of our staff members, actually, of them had experienced death. It was her dad, her father, and this father was one of the pillars in our community, and so really it touched us in so many personal levels. The reporters were talking about numbers and statistics, and we were talking about, our the relation that we have to that person who just passed that we just heard of. Like, oh, my uncle just passed away, or one of my board members' father just passed away. So it really touches. I think it touched us in so many ways. And another thing is that although COVID is horrible, we all have experienced the destruction that it has left in its path. But although, it really just magnified all these issues that we had prior to COVID-19. So if people were, if had doubt about the health condition of the Marshallese community here in Arkansas, the COVID-19 really gave them, the real deal. It's just like a reality check for everyone. But I also want to share that, and this is, we're talking about how important partnership is. Prior to things getting worse, I reached out to Dr. Nia and a few folks, the health forum and the APCHO team, to see if we could possibly do a community need assessment, because we knew that we were going to get hit pretty harshly, but we didn't know how bad. And from the community need assessment, one of the top 5 needs was really help for bills, to pay for rent and their bills. And to this day, that's the case that we're seeing through the work that we're doing. And then the third one was PPE. PPE. Actually, that was the first one outside of household needs, including rent and bill. The third one was PPE, which it was kind of surprising to me at first, but it just tells you a lot that people, Pacific Islanders and the Marshallese here in Arkansas, really wanted to take care of themselves. Unfortunately, because to me, the pre-existing condition prior to COVID-19, we couldn't control it, unfortunately. So that's the importance of partnership, and that's important, especially right now with COVID-19. There's no way, and I must say this, there's no way that I could have done, and ACOM could have done, including the board and the staff, could have done what we're doing right now. We have a food pantry that we started because of COVID-19. We've been offering services around rent. We could have never done all of that without the partnership that we have, without the support that we get. And, again, Pacific Islander, I have sisters and brothers. Nia was always there. Andy's always there. And Andy came in with the mental, Andy and I, our work, went back a few years ago when we started working on, a study on mental health. And, I can't share what the outcome of that study is because I'm really excited about that. Hopefully he'll bring it up. Very, very good, juicy information. That's what I call it. But yeah, just, the fact that a great support team and great support system is in place, it allows us to do the things that we need to do in order to serve families.
Thank you, Melissa.
Thank you. Andy, what are some of the issues that disadvantaged communities have that you've seen in dealing with COVID-19? Oh, I think you're on mute.
Yeah. You're on mute. You are. Let me see if I can unmute you. There you go.
Perfect. Okay, yeah, it was unmuted on my side. That's strange.
Oh, it's weird.
Yeah. So the question was, what are some of the factors for disadvantaged communities that make? Yeah, I guess part of what I research is mental health, but really when we think about the things that make pandemics worse or that disadvantage certain groups, it really is the term disadvantage that keeps popping up. And that means things like income, education, right? All the social factors rather than the health factors that we typically think about, like exercise or diet. It really comes down to, during a pandemic, does one group have to go out there and interact with customers? Do they have to serve people who might be contagious? Are they having to take public transportation? while other groups can just work from home, stay on their computer all day, right? Protect themselves from other people. And it really comes down to issues like employment, underemployment, income, money. There's a whole theory around something like this called fundamental cause theory, where you have issues basically like who has political power. And that really affects who's going to be affected for any type of health issue. It could be COVID-19, it could be HIV/AIDS, it could be hepatitis, right? Or it doesn't even have to be infectious disease. We see things like obesity, diabetes, cancer that are incredibly high in Pacific Islander or other disadvantaged communities. And it's not necessarily that they're more prone to this type of thing. It's more that they are living in these disadvantaged situations.
I see. No, and that does make sense that if you're already at risk or in danger of you're living paycheck to paycheck, or you're more worried about day-to-day needs, if there's any interruption, it's always going to affect somebody who doesn't have those issues to worry about. It's going to affect the people more that have to worry about that from a day-to-day perspective. But I personalize everything, and I think you were looking at me when you said diet and exercise. At least I personalize it that way. So from your perspective, Melissa, what's key right now in the Marshallese community? When I was saying earlier that the data was eye-opening, Nackie and I hosted a town hall, and the outright numbers from Arkansas, not per capita, not levelized for population, not, any of that, just the outright cases were higher by sheer number in Arkansas than it was in California. And that just, I had to check that 3 or 4 times. Are you sure that's not, leveled for population? So talk a little bit about how or what's important right now to the Marshallese community that you're a part of, that they're looking to you for, that you're working with.
So what's important for our community at this point are the immediate needs, right? And I think the immediate needs being, how do you ensure that they don't go to a point where they become food insecure? And that's why we started that food pantry. Again, going back to that assessment that we did, it hasn't changed. If anything to change on that assessment would be the need for PPE. But as far as the need for families to receive continuous support around rent and paying bills is still the top. Those are still the top 2. So I think it is our job as an organization to continue looking for those resources. So we have been literally having sleepless night, talking to funders and literally looking for ways to ensure that those particular programs do not stop. Make sure that you are always on the go for your community. But also another thing that's very, very important to us as Marshallese here in Arkansas is health equity, right? We're having all these issues because of health. To me, it's injustice. This is an injustice that's been around for over 25 years. When in 1995, when that welfare reform kicked in, that just knocked out, they call it by accident. It was an oversight. And I like what Andy brought up about political power. And this is certainly one group that does not have that at all. Not any locally. statewide, not at that point yet. We're still a community that we're still building. We're still building the infrastructure of this community. So hopefully, maybe 10 years from now that will change. But at this point, there's literally no political power. So we have to rely on our partners from various organizations and agencies in Arkansas, including Arkansas Advocate for Children and Families. That's a very strong partner that we have that always work with us on policy. And I'm really happy to say that we're working with them this year, getting stuff ready for the next session. Hopefully we'll get to introduce something into the legislature comes 2021 after the election. So it's very important, if you out there, you're listening to me, you need to ensure that you go to the poll this time and vote. It is very, very important, and I think that it's health injustice with the COFA. Marshallese here in Arkansas has been there for over 25 years. And I think if our legislators have not, whatever happened during the COVID-19 and has not awakened our legislators, then something is wrong with that. And it's all about health equity here. And I think that's probably the biggest need that I see. And so all these little work that we're doing, I think in November 1st, that's when Affordable Care Act is going to open up. And we will have Marshall Islanders who will be able to enroll themselves into the health insurance system. But even with that, that's still a complicated system. Sometimes it takes multiple try for a Marshallese person to actually get to select health coverage. So all these little things that we're doing, they matter. They matter. Every step that we take is very, very matter to the big. Hopefully, the big. I'm talking about next year with legislators and things like that. Hopefully, it will lead to bigger work, especially around policy. So I think the system is not designed to serve this particular community. We see that when people come in and apply for unemployment here in Arkansas. When they come in, the drop down menu is not. It doesn't say Marshallese, or it doesn't specifically state the status that Marshall Islanders have or COFA citizens have living here in the United States. So, it's just not designed for us. And it make things more complicated. I'm talking about all these issues that we're seeing as a provider, but we just need our partners to be there and to be supportive and to be a good alliance when the time comes, or when we try to push a big legislation in.
Do you think this will affect the community's voting participation?
Yes, it will increase voting participation. Actually, this year, this election has changed. This is the first election that I'm seeing more younger Marshallese that are getting involved, and we're getting to a point where the Marshallese children that were born to at least one Marshallese parent here in the United States, in Arkansas, they are of age to become voters. So there's a lot of that. You can see there's that high level of interest from this particular, I think they call them, is it Gen Z or something like that? So you're seeing that interest in them, and they're getting, they're smart. They're smart young people, and they're college students, and they want to get involved. They want to be heard. So definitely, for sure, yeah.
How about you, Dr. Subica? Do you think in the Inland Empire, do you think that's I don't know, Inland Empire, but Southern California, the whole, overall, do you think that disadvantaged underrepresented communities are going to be affected by the virus, by the pandemic, in terms of voting?
Oh, yeah, it's interesting because it could go either way, right? People would be more worried to show up. Yet you're finding that, at least on the Democratic side, if we're talking about parties, the enthusiasm is so high. The mail-in voting's off the charts.
Yeah.
One thing that we typically do see, though, that Melissa hit on that I thought was real interesting is typically younger generations, especially the youngest people who can vote, aren't really that active, right? It's usually older adults who are the most consistent voters. But now Gen Z is really seems like they're flipping it.
Right.
I'm seeing some real interesting things about how Gen X, millennials, right, versus Gen Z. The difference they say between millennials and Gen Z is that both are pretty woke, right? They're social justice oriented. They really don't like what's happening in the country. But Gen Z is activated. They take action. They fight against the system in a way that they say millennials, of which I guess I'm Gen X / millennial. I'm on the tail end. We're typically not as politically activated, even if we have strong opinions. And that's also, I'll say, an issue for both the Pacific Islander and Asian American community. It was always the silent community when it comes to political power, right? Whether it's because they were denied voices or also just haven't really had the engagement yet. This new generation, I think this election is really bringing out a lot of unique people who wouldn't have voted before.
Right.
Whether we sustain it or not, though, is kind of my concern. Like the pandemic might be what's creating this surge we might expect among some people that we wouldn't see voting. And then if the pandemic is done and everything, right, the problems are still going to be there. The disadvantage, the I'll be honest, the mass trauma, the long-term trauma that happens after something like COVID-19 hits the Marshallese community out in Springdale, right? That's going to be decades of recovery. But is the political power, is the attention, is the money still going to be flowing? Not sure. That's probably my biggest concern. Yeah.
I think I was looking at the numbers today. 63 million people have voted at this point.
Wow.
It's 46% of the total turnout of 2016.
Wow.
But the question, and the Democrats are more involved in the early voting. But I think the question that Andy brings up is a legitimate question. Is this going to maintain and be record turnout, or is it going to tail off as we get close to election day? I would point to Texas. Texas right now is 80% of 2016's total vote. I don't see how those states don't shatter what happened in 2016. I really think there were people that were indifferent in 2016, and they didn't feel too much different about either one of the candidates. I think the country's polarized now. You're going to the polls one way or the other. You're going to vote for I want 4 more years, or you're going to vote for I don't want, but not too many people are sitting on the sidelines. I would be pretty shocked if it's not near record or record turnout, but definitely I would think there's more voters engaged, because not nobody, but there's far less people that are indifferent. So in terms of when we say power and political power, because there's $1.3 trillion a year that go out to different social programs, and it's important that everybody is accurately represented. Talk a little bit about political power in terms that you deal with. So like at the local level, getting involved in city council elections, getting involved in mayoral elections. Are those things that you see that are important with the Pacific Islanders that you're dealing with?
Is that to me or Melissa?
Both, either one.
I'll let Melissa go because she's being super active in this area right now.
Yes.
Yeah.
So I've lived in Springdale since 2004. And I think this is my second, maybe second election. Um, and I had never, it's ugly out here. Unfortunately, we do not have any Pacific Islanders who are running. I'd actually consider to run myself at one time, but I do have some personal stuff that I need to take care of before I run. I feel like you need to make sure that when you go in, you're clean, right? But what's happening here is it's becoming, it's quite ugly. I mean, it's campaigning is turning to where I never thought it would turn. Really, people are just focusing their attention on the negativity of their opponent and bringing up personal stuff. And I've never seen it. It just different. Unfortunately, again, like I said, unfortunately, we're not at that point yet where we're seeing a lot of Pacific Islanders wanting to run. Again, I think give it about 10 more years and you'll maybe see a change in that. I do see, again, like I said earlier, a lot of the younger generation that are wanting to get involved and wanting to learn about what's Biden believe in, or what's Donald Trump believe in, and what is this? We actually have the first African American. There's one African American that is running, and there are two Latinx candidates that are running as well. So it's a little different in that sense because it's been all white from the very beginning. So there's some people of colors that are running this time, and it's not pretty. It's not, they get talked about on Facebook, and which I don't think is professional, but I guess that's campaign, and I guess we all should expect that. But hopefully that will change in the next 10 years.
Someone is wanting to know about the juicy research results that you spoke of in mental health.
It's Andy's job.
Yeah. Yeah. Well, I guess you want me to just talk about the result?
Yeah.
Or, yeah. Okay.
Nackie. Yes.
I mean, at the end of the day, every time Melissa and we do studies, or I do studies of Pacific Islander communities in California, in Hawaii, wherever, the results are always pretty consistent, and they're consistently not good. And so it's always a little bit of a surprise that it's so consistent, but I guess at this point it is what it is. So the reason I'm kind of saying this before I get into it is because it's so easy to talk about, well, this is the problem, this is the problem, this is the problem. And I just want to reinforce that it's not just about like finding the problem. And we can talk a little bit more about how do we actually address it afterwards. So yeah, just off the bat, we've done a number of studies, and we've done them with ACOM and through Melissa and other organizations. When we look at mental health, there's very little mental health data that is actually drawn from communities. We have some data from these large national data sets where people call all over, and they might get a little portion of the Pacific Islander community. But what we've been trying to do, Melissa and I together, is actually get into the community to ask these questions and get a real sample of what's going on. So in the first study we did around mental health, we found, and we talk about things in terms of prevalence, like what is the rate of X disorder or Y disorder. So when we looked at, for instance, depression, what we found was in these community surveys, Native Hawaiian Pacific Islanders have about 3 times the rate of depression, major depression, really, compared to the US general population. So that's 3 times greater. When we looked at anxiety disorders, which are also very common in the general population, for Pacific Islanders, they are about 2 times greater. And then the one thing that really struck me and Melissa and all my colleagues was when we looked at alcohol use and what's called alcohol use disorder or alcohol addiction. It was about 4 times the US general population rate just when we looked at Pacific Islander adults, right? So we looked at communities and we weren't trying to look for the people who were seeking treatment. We were literally just going into churches. We were going into rec centers to try and do this. We were going into, organizations that serve Native Hawaiian Pacific Islanders, and we were still finding rates 2, 3, 4 times greater than we would hope to find, right, above average. And those are really massive disparities when it comes to mental health and substance use. So then we're doing some additional research. One thing Melissa was, I think, referring to is we just talked earlier today about the results of a second study we did where we looked at Pacific Islander young adults because the community saw the high rates of alcohol use that we were finding in our surveys. And they said, well, really the concern is not adolescents, not so much older adults or middle-aged adults, but we're young adults. 18 to 25 to 30 years old. And so we did a study just specifically on these individuals in Arkansas, in California, and we found some astonishing rates. When we looked at how many people were screened positive using just a survey for alcohol use disorder, which is alcohol addiction, 49% of all the young adults that we surveyed between 18 to 30 years old screened positive for having alcohol use disorder. And 41%, so 4 out of every 10 young adults between 18 to 30 in these communities screened positive, basically tested positive for severe alcohol use disorder. So it's this type of data that, absolutely is just astonishing, juicy, but it's also data we've never really had before. And so we are now trying to figure out what do we do about these ridiculously high rates.
And do they give a reason? Like, is there a common reason why they're drinking or the numbers are high?
Yeah, so part of it is the surveys are just one part of the studies that we try and do because knowing what's going on is important, but it's just the first step. The next step is understanding why, which is exactly what you were asking. So for alcohol, what we want to figure out are what are the risk factors? What are the factors that are making Pacific Islander young adults so vulnerable to binge drinking, and we actually got a lot of good information. Some of it is what you would expect, peer pressure. One thing we did notice though is, and it's been consistent, and I actually think a lot of people would agree every time I talk to, is there is a social norm in a lot of Pacific Islander communities here in the US at least, that when you drink, you don't have one drink, you maybe don't have 2 drinks, you have multiple drinks. Because drinking seems to be a very social activity. You don't necessarily hear a lot of stories of young adults who are just drinking bottles of liquor by themselves at home. But then there are a lot of gatherings, there are a lot of parties, there are a lot of situations where when they drink a lot. New Zealand had this interesting statistic when the Ministry of Health looked at it, where the average Pacific Islander in New Zealand drank 21 liters of alcohol per year versus 11 liters of alcohol for non-Pacific Islanders in New Zealand. So there's this tendency, it seems like, for drinking to just become very heavy, especially in social situations. That's one of the things we notice. The other part is, to manage what we call self-medicate. If you find high rates of mental health issues in a community, you're going to find high rates of substance use issues because drinking is a main way that I think people cope with mental health, with just stress. I'll just say stress in general, right? Whether it's from COVID-19 or work issues or family issues.
I think when you look at ethnic groups that are, or just any groups that are near or at or below the poverty line, the stress of living in that environment. Again, not knowing where a meal's coming from, not knowing if your kids are going to go to school, not knowing, those kind of things that when you look at the average of the country, the average of the country isn't going through, those kind of things that make you want to me, people that drink to excess are drinking to numb themselves from something that's going on in their life. And if it's, depression, like when you were talking about the things before you talked about the alcohol, I'm not a clinician or a research person, but those things are things that to me would point to leading someone to numb themselves, either with drugs or alcohol. And I think it is particularly disturbing to the Pacific Islander group, because we're one of, if not the youngest ethnic minorities in the country. We have, I think it's the highest, if not the highest, one or two, ranked first or second, the percentage of our population that's 18 or below. So I think Melissa hits the nail on the head. Like, is Gen Z, in 10 years, the ones that are very involved at a young age in the political process are probably going to be the ones running for office. They're probably going to be the ones getting to those positions of decision making.
I'm sorry, real quick. In your survey, the economic status, did you find, depending where you land, in the lower income families, were there more depression than higher income? Did that come into play into the numbers?
Yeah, so for the mental health survey, we actually didn't focus too much on income, although we collected that. For the young adults, it's interesting because it did seem to play into it a little bit. Lower income increased some risk. But I would say there are certain factors that were probably more strong than income. Because what we do is we do include income in some of our analyses, oftentimes to see if income pops. Right. as a strong, what we call predictor. And income didn't pop nearly as much as other things. Interesting enough, education seemed to have a major effect. And then another one was acculturation. And that's speaking a little bit to what Carl was saying. What came into my mind is also just being a minority or coming over to the US, and you have to accommodate with US culture, cultural norms. It's not easy, right? And we're finding, just in general, Gen Z, for all their positives, has more mental health issues, it appears, than other groups. They're struggling more with stress, with mental health, with substance use to some degree, and definitely with suicide. So there's a lot of positives and a lot of things to worry about coming down the pipe.
And was there a survey on suicide? Since September was suicide month, we see that people are asking for info on suicide, as suicide month was of September.
We did, for the mental health, ask a little bit about suicide, but I actually tend not to report that data so much. What I would say, and it's because it was a little bit of a smaller sample, and it's a tricky question to ask people, right, in a survey. Yeah. What is interesting is previously I did some analyses on 25 years of federal data among high school adolescents. So they've been collecting this for 25 years. We looked at it, and that's when we started to see, and this is so among youth, high school students. And what we found was that suicide rates were 2 times greater versus, at least attempted suicide, were 2 times greater than the general population. We saw just a lot of disparities in depression. And we tend to focus on adolescents when we talk about suicide to some degree, because they are so vulnerable, right, to suicide. And there is definitely a suicide epidemic. We've known about this in the Pacific Islands, right, in the region, and it does seem to be transporting here in the US. We just don't have that much data about it yet.
Right, right.
You are listening and watching Koviki Talk. It's a 21 episode series where we talk about COVID-19 from the Pacific Islander perspective with experts and panelists from across the broad spectrum of the COVID-19 pandemic. So today we have Dr. Subica and Melissa Leyland, and you're getting the results. We talk about Koviki Talk being on time, timely information, up-to-date information. That's one of the things that we pride ourselves on, is we are giving like up-to-date information. You're getting the results of a study that's done. In speaking to that study, Melissa, are there things, did it confirm things that you kind of already knew, or were there things that came out where you were pretty shocked?
I had this conversation with Dr. Andy earlier, and he's, telling me like these numbers are going to be so shocking to people. And I said, I know, but unfortunately, I'm already used to these numbers. I think, and that's why we asked him specifically. And I remember meeting him for the first time, and Dr. Nia introduced him to me, and and at that time I was actually working as a court interpreter. I've been working in the court system for a while, and I had noticed that we were dealing with a big issue with DWIs. What was the biggest one was PI, public intoxication. And I'm thinking, wow, this is pretty serious, and I'm not you're understanding it. So, Andy came in, I was like, wow, this is going to be, we asked him to do this. This was a community asking Dr. Andy to work on it, and Dr. Nia. So it doesn't surprise me at all. Even with my work with juveniles, I was working with juveniles as well as an interpreter, interpreting for these families. A lot of those cases were, alcohol related, whether it's the parent or the child himself or herself. So I was seeing a lot of that as well. So I think it was, when you know for sure that things are happening, we just need someone to back you up on it. And I think this is a perfect example. This is a perfect example of a great effective partnership. A community organization identified the issue with the community members, asking the professionals to come in to step in and invest the data.
I think it's so important that
That's great.
that you folks are the ones that are leading it. So if I'm in, way back pre-COVID, if I were in a mall and somebody were to come up and start asking me questions like this, if they weren't Pacific Islander, I probably wouldn't give them, 10 seconds of like, no, dude, I'm busy. I don't have time for that. I'm shopping or whatever. But if a Pacific Islander approached me asking for data or asking me to spend time, it's definitely something that I would do. I'd be far more likely to do if it wasn't somebody that's wasn't a Pacific Islander. Is that something that as you do these studies that you make sure that the people that are out there trying to get the data look like the people that they're talking to?
1000%. Yeah. On the go, Melissa. Yeah.
Yeah, I think so. I think it's very important. Me as a woman, a Pacific Islander woman, I feel like, and a Marshallese woman, I feel like I have to work 3 times hard at something to be accepted. Just let that be that. But as a Pacific Islander in general, I think it's very important for me to connect the dots with someone who has more knowledge, more expertise, like Andy or Nia, that understand. They might not speak my language, they might not speak Marshallese, but at least understand the same background. We are from the same background, and they can explain it well. They have the expertise to do these things, and I can rely on them. And yeah, it is very important for me. That's why I always reach out to either Andy or Nia to look at, especially when it's a project that involves research and data. Thank you, Andy and Nia.
Yeah, then to kind of follow up on that, Carl, 100%. One of the things I guess I would say for anyone thinking about research in a partnership, I'm at a university, so I'm what's called an academic, basically. And then Melissa's with the community organization, so she's the community. It's these silly distinctions, but what is probably the most important thing I've realized is both sides are constantly learning. I think when we think about research partnerships, we tend to think that it's the community having to learn how to do research, what research is, and the academic is trying to educate them, but it really is the opposite way. To do good community partnerships, especially for Pacific Islander communities, I'm learning way more than Melissa's learning, right? I'm not from the community. I know nothing about Springdale until I visited. I know very little about what their experiences are there. And so it's constantly Melissa and her staff and Dr. Nia educating me. And that is really, I think, the only way a research partnership works is if, Melissa doesn't get tired of, this, dumb academic doesn't know anything about us, right? It's very easy for her to come in and think, well, why would I even work with Andy? But to her credit, she was open to it, right? And was doing it. And so it was really more about the researcher learning and being just really humble. And I say this because we spent a long time learning these research methods. We go to school for a long time. And yet I cannot do a single study that I mentioned without Melissa and her team doing the surveys for me. I mean, if I tried to do a single survey in Springdale, Melissa, I could be there for 2 years and probably get 10, 12 surveys. I work with ACOM and they can get 100 surveys in 3 weeks, right? On these really sensitive topics too: suicide, alcohol use, alcohol addiction. These are things that nobody not from the, someone not from the community, no chance we could conduct effective research. Yeah.
Well, as a member of the community, I thank you both for working together because we're benefiting from it. So you're both playing a huge role in getting information, and a lot of it's validated, right? Like, to Melissa's point, she kind of knew what she already knew, but she just needed somebody to do to give her the data to say, look, this is the problem. I already, I see the kids. I know that that's a problem. I think I just wanted to say thanks for finding a way to work where you both benefit, but in the end, the community benefits.
Mm-hmm. We have a question from an attendee. What are things that researchers can do to be better partners for communities?
So I'm only going to give my own opinion. Every researcher is different, and so there's no one right way, one right answer to this question. Mm-hmm. My experience is flexibility is probably the most important thing. Right. For those who don't know research is actually very limited. And this is one of the first conversations I have to have with anybody I work with. Melissa and I had this conversation up front. It takes a long time to do. We have to go through all these approvals. Some of the other Koviki podcasts have talked about, right, the issues with clinical trials. It takes a long time to do good research. And you don't often see the results for years, right? And researchers are very good at studying one thing. The traditional research, I'm a clinical psychologist, so I actually specialize in mental health. I'm not considered an alcohol researcher. And then so when Melissa asked me to look into this alcohol issue, I really had to overcome the fact that I'm not competent in this area and learn it just so I can start working with Melissa on an issue that she thinks is important. Right. And it's that flexibility that a lot of researchers, it's very hard to do, I would say. this alcohol study, we're still in the middle of it. It took about 3 years from the time that Melissa asked me to investigate this for us to be able to get the grant. Right. It's a painstakingly slow process. And so researchers just have to be flexible, and then community has to be patient.
Right.
Yeah.
Thank you, Doctor.
Thank you, Doctor. Do you, I just real quick, do you, with the alcoholism, how do, you know, for Pacific Islanders, I'm finding that it's hard for us to ask for help, right? It's hard to, it's like our pride. We don't want to say that we need help. How can we get our people help that are going to alcohol for the answer? Or is there an answer to that?
That's interesting. I don't want to kind of, Melissa and I just actually talked about this. So I have some ideas. We've done some research on this, but I actually would love to hear if Melissa has any thoughts, just specifically for her community, because this is my chance to also learn, because I've never actually asked Melissa this question yet.
Yeah, that's a really good question. I think what I have seen during my time in the court system was that the court was actually mandating folks to attend like a therapy session or whatever the case was. Unfortunately, they didn't have, Marshallese qualified people to serve in that capacity. So they would, a lot of those things were not tailored, customized to fit the need of the PIs. So that's one way, I guess, to ensure that people attend these sessions. Another, to me, I think that it is always, and I also believe that constantly opening opportunities for education opportunities is very important. Letting people know what you're doing, what programs are there that are available. Unfortunately, we don't have anything that is specifically on Pacific Islanders at this point here in the area, but I always believe in that opening up the space. If we were to do a service like this, we would ensure that the community know that it's available for them, and just make them feel welcomed, and encouraging folks to attend these sessions is very important. I think that's very important. Obviously, we don't have anything at this point, so that's all I can say at this point. But hopefully, when things are available, maybe we'll figure it out, and we'll find out that there are other things that are very important,
Right.
that you have to make sure that you offer to the people.
That was good. We actually did look at this, Nackie, when it comes to alcohol specifically. So we look at barriers, what keeps people away, and then what might bring them into treatment. And the number one barrier usually is stigma across all the communities, right? There's the shame, there's the pride.
Right.
They all play into it. When it comes to alcohol, what we found was a little bit surprising. When we looked at what were the predictors of whether someone would think, oh, hey, I should get treatment or not for alcohol. And what we found was that for a Pacific Islander adult, if they had an alcohol use disorder, right, they met the criteria, they were basically had alcohol addiction, that did not actually predict whether they felt they needed to seek treatment or not. And that, I think, plays into what we're talking about. To some degree, using binge drinking a lot, getting very drunk, there might be some aspects where it's very socially accepted or at least understood that it may not be a problem. But what did predict whether they thought that they needed treatment was if their alcohol use affected them in other ways. We called it harms. Was it affecting their friendship or their social life? Was it affecting their work? Was it affecting their family life? And those things actually increase the likelihood that they would think that they needed to seek treatment between 5 to 13 times. So if somebody perceived that, oh man, my work is being impacted by my alcohol use, 13 times more likely that they would say they needed to seek treatment. So that actually teaches us now when we talk about interventions, we need to do more around getting people to recognize the harm that alcohol use is doing to their life, rather than what we typically do, which is we try and get people to get insight that they have a problem.
Right.
Right? You see these interventions where the family's like, you have a problem, you need help.
Right.
Our research shows it won't work. It's more saying, well, you are drinking alcohol and it's affecting your family.
Right.
That seems to be more motivating for Pacific Islander.
Right. Messing with your money, right?
Money, family, social obligations, the ties that bind people. Yeah.
Awesome. Thank you.
Well, an hour has flown by, and I want to thank you both for being on and sharing time with us and sharing time with the community. Once again, this is Koviki Talk, a 21 episode series where today we get a peek into the world of research from the perspective of a community activist and a nonprofit executive director out there in the trenches, swinging the bat, being a champion for our people, and an academic that's in there getting research done and doing studies that we need the information and we need that kind of data. So thank you, Dr. Subica. Thank you, Melissa Leyland. Koviki Talk is brought to you by Pacific Islander Center of Primary Care Excellence and the NHPI Policy Council. Tune in next week, same time, same day, and we will share more COVID-19 information with you from the PI perspective. Thank you all.
Thank you so much.
Hello, everyone.
Thank you, everyone. Have a good night.
You too.
Thank
Thank
you.
you.